It's my pleasure to introduce our first speaker, who really needs no introduction, our Chancellor, Dr. Jeffrey Gold. And as you know, he's not only a senior leader of many of our operations here, clinical, research, and so on, but also he's a tremendous educator and has national experience serving on over 50 different organizations in very senior positions in education. And really, we're asking him to come up here and give us a frame for being bold about education and how we're going to become and really maintain this tradition of excellence as a premier education institution. So please help me welcome our Chancellor, Dr. Jeffrey Gold.
Well, thank you so much for the introduction, and thank you so much for the opportunity to spend some time with you while you're eating, and please do eat. I usually get the unenviable position about being the last person to speak before somebody gets to eat or the end of a meeting, so people are getting fidgety and watching the time, but this is really a true privilege. So when I was asked to do this, they asked me if I would prepare a slide deck, handouts, etc., but I have no slides, I have no handouts, and I have no notes. I am going to attempt to speak to you from the heart about educational innovation and some of the thoughts that I've gleaned over several decades as an educator in the trenches in the health professions. I have had the opportunity of being directly responsible for the education of nurses, pharmacists, physician's assistants, physicians, and many other healthcare professionals, as well as had the opportunity on a leadership level on several boards and organizations to think through where we are and where we're going, and even more recently to listen to the public opinion on how we're doing. And so if you were to take the 50,000-foot view, if you were to go to the austere halls of the United States Congress, if you were to go to the various offices in the state houses across the country, and ask the question is, how is the health profession doing in their educational processes, they would tell you that it's broken. They would tell you that, and you know, as I love to tell these people, I represent that remark in the truest possible sense, because I have been involved in developing the programs, in creating the policies, in looking very carefully at the funding structures, trying to make the best out of them. But I think when people look at us, at what we do, they are dissatisfied. Not to say that they don't love the relationships that they have with the nurses and the dentists and the pharmacists and the physicians who care for them, but they don't think that we are creating the health workforce for the future. Not that they know what that is, but they don't think that we are. They don't think that we are adequately shepherding the resources that they invest, and they invest a huge amount of money in health education professions, both on the level of Pell and Stafford lending, which has now exceeded total U.S. credit card debt. By the way, it's going to make the housing bubble look like nothing if we can't get our hands around it. They think that there have been major deviations in the professionalism, not that they would ever question the professionalism of those that care for themselves or their families, but that they have witnessed all too often deviations in the quality of care, errors in medication, errors in decision-making, if you will, the non-professional aspects of the health profession's practices, and they are more than willing to call that out. And so while I look at the audience like this and the program that you're about to sit through as visionary, inspiring, and I know that I am truly preaching to the choir, quote unquote, I think it's only fair that I share with you some of the sentiments and concerns that are being raised on a national level. Now, there are only a fixed number of responses that we on a national level can take to that, and I spent the first 2 days of this week in Washington, D.C., addressing some of these very issues with shall we say, a very austere group of senior leaders about the relevance of what we're doing, the sustainability about what we're doing, and essentially advocating for continued investment in the future of the health profession's education as we know it, rather than blowing it up and starting from scratch. Again, not that these people have any brilliant idea as to how to blow it up and what it would look like, but they are looking at what we're teaching, and they're really concerned about it. So I would say that the challenges are sort of arrayed as follows. The first question is, who are we teaching? How are we selecting young women and young men to be our students today, and do we want to rethink that process tomorrow? Does the ability to take a number 2 pencil and fill in a tiny little circle on a piece of paper, or the computer equivalent of that, actually equal the person or cohort that are going to be the best and the brightest and have the most sustainable careers? Another question that I hope you're going to deal with is, what are we teaching? You know, we spend an awful lot of time discussing how we are teaching, the pedagogy, or better now known as the andragogy, as these are basically adult learners. But we are spending a lot of time on flipped classroom, high technology, simulation, upside-down learning, adaptive systems, blended curriculum. And believe me, I've spent the last decade and a half of my life involved in thinking about those thoughts, and they're wonderful because they relate to how people acquire and retain useful information and how they ultimately use and transmit useful information. But I don't think we've spent all that much time thinking about what we are teaching. Is the curriculum current? The content of the curriculum I'm talking about from a purely educational perspective. And that gets into some very, very difficult questions. I mean, we have taught the same content in all of our specialty areas for a long time. Sure, we have evolved it as technology has evolved, but I'm not so sure we've taken a really hard look at what is being taught as much as we are about how we teach. So interprofessional education is one aspect of what we teach and how we teach, but I'm not so sure that we've really kicked the tires on that as hard as we can possibly kick it. Another major question, forgetting for a minute who we teach, how we teach, and what we teach, is how we assess. How do we assess the outcomes? Again, is it the ability to answer multiple choice questions, to have a structured interview, to be videotaped with a simulated patient, or to count the performance time for 100 endoscopies in the Sim Center? Is that the way we assess it, or are we missing other areas? Because we talk about the core competencies that we want to teach, and we of course talk about moving from a time-based to a competency-based curricular model. But implicit in that is, if you're going to move from a time-based curricular model to a competency-based curricular model, one has to be able to assess the outcomes of that in a reliable way. After all, we have a moral and ethical obligation to society to turn out a cohort of healthcare professionals who are frankly good enough to take care of us, our families, our children, and our grandchildren. And the last thing in the world we would ever want to do is compromise any of these parameters to do anything but educate to that level. And I think at the end of the day, that is the goal of this meeting, and any meeting regarding education is, what are we doing for the next generation of health professions workforce to be sure that we would be perfectly comfortable to ask them to care for our children and grandchildren and great-grandchildren when that day comes. And don't forget the knowledge and skills, the professionalism, the attitudes and behaviors that they will acquire, they will carry with them through a 30 to 40-year career. And so that will be enduring for a long period of time. And so we collectively, at our institutions, in our colleges, in our programs, and across the United States, teach to the test. So in the medical school world, we teach to the USMLE step exams. In the nursing world, we teach to the NCLEX, and on and on and on. And I'm not sure that as health professional educators, we have really asked the question as to whether that is the be-all, end-all goal. It is the ticket to licensure in many of the health professions, but it may not be the ticket to the most competent workforce that we want. And as we think about movement to a competency-based education, we have to be able to answer that question: is, are we truly educating a generation of healthcare professionals who are competent. So again, in summary, what I hope that you will address today, but that we will address as a university moving forward, is who we teach, how we teach, what we teach, how we assess. And I would even suggest to you that some of that assessment is not going to be available for 10 years after they finish the educational process, or even more. I mean, one of the very interesting questions we debated earlier this week in Washington is, what is the end point of that assessment? How do you know whether an educational program is really working or not working? It really has to do with the quality of care that those individuals deliver, not just the quality and safety side of it, but the patient-centeredness side of it, how they are respected by their community, etc. So those are difficult challenges because those are not endpoints we have within our grasp. An NCLEX score is a lot easier to do standard deviations and averages on and point to and say, aha, we're meeting the grade. I'm not so sure, though, that it is the person with the highest NCLEX score that you want to be your bedside nurse or your child when, heaven forbid, she or he is hospitalized. These are serious challenges. They buck the paradigms that have existed since Flexnerian education was even first conceived over 100 years ago. It takes great risk and, frankly, great courage to think about these questions. But I actually think that the University of Nebraska Medical Center, all of our health professions colleges, are uniquely positioned to ask and to answer these questions, to take those risks. Now, why do I say that? Well, first of all, the faculty and the leadership and the deans and the university fabric itself, I think, is very stable. It has a long tradition of excellence. So you're building on a platform of people who get it. That is to say, the quality of the workforce that we have developed that now serve our communities, but also become our junior faculty who we then assimilate into it, are very high quality. So we're not starting from a position of weakness. Another reason is that we have been willing to take risk. I think some of the things under Dr. Davies' leadership and others around interprofessional education, around some of the thoughts we're having about simulation and virtual immersive reality, team-based care, etc., are right on. And so we have been willing to take some risk and to think out of the box. I think the changes in the governance structure of the medical center and the access to a gigantic, well-functioning teaching laboratory where we can not only experiment a bit on clinical teaching paradigms, but also have an environment where we can assess the outcomes with real-time clinical outcomes is also unique. And we're well positioned right now to do that. And then were that enough, I think the resources in this community nationally are present. And I don't necessarily mean just the magnificent fiscal plant or the financial resources provided by the state or by other means, but I mean the people. I mean each and every one of you. This is an environment where the faculty of this university are willing to roll up their sleeves and say, we can do that. We're up to that challenge. It's going to be hard work. There's going to be risk associated with it. And we may not exceed in every single one of those projects, but we're willing to take the risk. We're willing to extend ourselves and for the betterment. And I think that the thoughts that will come out of this kind of conference and the thoughts that hopefully will permeate your curriculum committees will reflect on some of that. Now, I can tell you, having spent 6 years on the board of the LCME, having been involved in many other accrediting organizations over the years, that saying that the accrediting bodies and the national groups are not going to tolerate that kind of change, that the people who write the NCLEX and the NBME and others, the overall alphabet soup of assessment and quality, are not going to allow change. I will tell you that that's nonsense, that I have yet to see a single viable proposal for changes in curriculum, for changes in andragogy, for changes in assessment pushed back on. Just to give you an example, there's a proposal and an ongoing pilot in Oregon Health Sciences University that will reduce the entire length of medical school to 2 years. Now, I mean, that's really thinking out of the box. And I can tell you that there are any number of people in Washington and elsewhere who think that the entire length of a health profession's education, including all of undergraduate school, graduate school, residency and fellowship training, should be no more than 7 years soup to nuts. And this was based upon an economic study on return on investment of what the tuition dollar could buy in terms of lifetime earnings and impact on society. Now, I mean, that number is a lot longer. I mean, for myself, that number is probably almost 20 years, you know, so I think about what that would have meant to the productivity of a career if you could get that down to 7 years, and hence the tremendous interest on a national level as to what we're doing and why we're doing it. So I guess in summary, first of all, I thank you for the opportunity to sort of kick off this event. I commend the organizers greatly. I think it is wonderful. I'm deeply sorry that I can't be with you for the entire length of the event. I actually am going to be doing a greeting over in the Trulson Events Center for some of our incoming students, and I love those events. They are really invigorating. They provide incredible inspiration to me as to why we all get up every day and go to work. I mean, what we do is we change the world, and on the educational side, we change the world by creating the next generation of people who are going to carry the same value set and have the same vision that we do. And so I thank you for the opportunity. I wish you the very best in your conference. I look forward to learning more about these programs. But I hope as you go through the day, you will think about those questions of who we're teaching, how we're teaching, what we're teaching, and how we assess it and what the real end goals are. You know, I would suggest to you that a lot of the end goals that we currently cherish are really surrogates for much more meaningful outcomes, and that it's time to get down to the question of what those outcomes really are. Thanks a lot and have a great afternoon. Appreciate it.